Diseases of the hypophysis, which is the pituitary in dogs and cats. The hypothalamus controls the anterior lobe of the pituitary by releasing and inhibiting factors. The anterior pituitary produces ACTH, growth hormone, TSH, LH, and FSH. The posterior pituitary produces ADH. The diseases of the pituitary. So you have congenital hyposomatotropism, alopecia X, acromegaly, and diabetes insipidus. For congenital hyposomatotropism, somatotropism means growth hormone, so you have decreased growth hormone. It's usually caused by a cyst on the anterior pituitary, and the treatment is to give bovine or human growth hormone. For alopecia X, it's usually caused by low growth hormone. It's usually a cosmetic problem only. So the treatment is to give growth hormone, but it can be diabetogenic, so you need to consult the owner that it's only a cosmetic problem. Acromegaly is excess growth hormone in mature animals, and it's caused by iatrogenic progesterones. And diabetes insipidus is caused by decreased ADH, which causes severe polyuria and polydipsia. The treatment is to give desmopressin, which is synthetic ADH. So the relationship between the hypothalamus and the pituitary. The hypothalamus exerts control over the anterior lobe through releasing and inhibiting factors that reach the cells of the anterior lobe via the pituitary portal system. The posterior lobe has a downward projection of the hypothalamus. It is a reservoir or storage of hormones from the hypothalamus. The anterior pituitary produces ACTH, growth hormone, PRL, TSH, LH, and FSH. The posterior pituitary stores two hormones, vasopressin, which is ADH, and oxytocin. The first condition is congenital hyposomatotropism, which is growth hormone. It's a deficiency in the release of pituitary growth hormone. For the signalment and pathogenesis, it mostly affects German Shepherds. There's an autosomal recessive inheritance, or there can be a cyst formation on the pituitary anterior lobe, which can result in decreased growth hormone and later decreased TSH, which leads to decreased T4, and then you can have secondary hypothyroidism. The clinical signs is poor growth in puppies. They have normal body proportions otherwise. They can later develop skin symptoms such as alopecia and hyperpigmentation and a thick skin. After 2 to 3 years, they can often get renal failure. For the diagnosis, do a skin biopsy and carry out a growth hormone releasing hormone stimulation test. And the treatment is to give bovine, porcine, or human growth hormone. For the prognosis, after 3 to 5 years, there's usually euthanasia due to the kidney problems. The next condition is alopecia X. It's more of a cosmetic problem. It was originally thought to be a growth hormone responsive dermatosis, but now it's not so sure. For the signalment, it's usually found in male dogs that are 1 to 3 years old in plush-coated breeds, such as Samoyeds, Huskies, and Poodles, and Pomeranians. In around 2/3 of cases, they have low growth hormone. It's possible that it's a mild form of Cushing's. For the clinical signs, we can see symmetrical alopecia and hyperpigmentation on the neck, trunk, and caudal surfaces such as the thighs. For the treatment, you could give growth hormone replacement, but it's diabetogenic, and since it's only a cosmetic issue, it may not be necessary. For acromegaly, this is when there's excess growth hormone in mature animals. For the signalment and pathogenesis, it occurs in middle-aged bitches. It occurs when you give exogenous progestogens for estrus prevention in dogs. It causes an iatrogenic acromegaly. It increases the amount of growth hormone in the mammary gland. It can also be caused by a mammary tumor, which also secretes growth hormone, or an ovarian cyst, which produces progestogen P4. It can also occur in male cats that are old or middle-aged due to pituitary tumors which overproduce growth hormone. For the clinical signs, their body dimensions change. They can have a big head or big paws, loose skin, and increased abdominal size due to hepatomegaly and renomegaly. They can also have a protruding tongue due to the increased size, or snoring or dyspnea due to soft palate increase. And cats can develop insulin-resistant diabetes mellitus. For the treatment, you need to discontinue any progestogens for estrus prevention. If it's caused by a mammary tumor, you need to do a mastectomy or an ovarectomy and remove the mammary tumor. And if there's diabetes mellitus, you need to do insulin therapy. For the prognosis, in dogs it's good, but in cats it's poor. The last disease is diabetes insipidus. It's due to decreased action of ADH. This causes the most severe polyuria and polydipsia. For the singlement and pathogenesis, it occurs in middle-aged or old bitches. There can be central diabetes insipidus and nephrogenic diabetes insipidus. In central diabetes insipidus, this is decreased ADH or no ADH at all. It can be caused by trauma or tumor in the hypophysis. In nephrogenic diabetes insipidus, there is an impaired action of ADH, so the sensitivity of the kidney tubules for ADH has decreased. For the clinical signs, the most severe form is central or complete diabetes insipidus. The animal will have polyuria and polydipsia and extreme thirst. It'll drink anything. The animals can get dehydration and hypovolemic shock and die. And the specific gravity of the urine is very low. For the diagnosis, you need to differentiate from different polyuria and polydipsia disorders by using urine and blood examinations. For the treatment, give desmopressin, which is synthetic vasopressin, also known as ADH. You do 1 drop into the conjunctival sac and it absorbs quickly from here. It has a systemic hormonal effect. And for the prognosis, the majority of animals become symptomless if they continue treatment with desmopressin, but animals with pituitary tumors have worse prognosis.